Hello, my name is Jay Shore, Managing Partner of Shore Solutions, a practice marketing consulting firm, along with our co-moderator, Mara Shore, Vice President and Partner of Shore Solutions. And we're here today with Dr. Gregory Chernoff, a board-certified facial, reconstructive, and plastic surgeon, main office in Indianapolis, Indiana, and Santa Rosa, California. Today we're going to be speaking about DefenAge and how Dr. Chernoff has incorporated DefenAge into his practice, into a very successful way of bringing the skincare regimen in for his patients. Dr. Chernoff, it's a pleasure to see you once again.
Nice to see you,
We
Jay.
see you at all the major shows, and now we are aware that you are bringing DefenAge into your practice. One of the questions I would like to ask you is, what was it, and we spoke a little bit earlier, what was the main caveat that allowed you to feel so comfortable with bringing DefenAge into your large practice?
Sure, Jay, and by means of introduction, for over 20 years I had worked with the same chemist in New York. We had private labeled my own skincare line. So when I first saw the science behind DefenAge, and I think that's really key to it, is there's, in the areas of skincare, there's always a lot of magic not followed by science. And the science behind DefenAge simply did not exist. We'll hear a lot about regenerative medicine, cellular medicine, stem cell therapies. And this was really the first, the science behind this is really the first of its kind. And when I saw the peer-reviewed literature that came out, which is also so very important, the value of having peer-reviewed articles and the science behind this product was really second to none. So the beauty of bringing a product like DefenAge into an office that already has established skincare lines is it's not a competitor. It's simply another addition to the armamentarium that we have to offer our patients.
Yes. And how do you, in speaking to your patients about the product, and in speaking, knowing that you have two different lines, as many of our fellow colleagues may have more than one line, but how do you market DefenAge to your existing patients, and how do you market the product to new potential patients?
And really, as opposed to marketing a product like this, we take the position of educating our patients, and the story tells itself. All of us have stem cells that live at the base of our own hair follicles. And these are the cells that when our skin is injured, these are the cells that are stimulated to make new cells called keratinocytes, the outermost layer of our epidermis.
Okay.
A scientist who developed this line found the protein peptides that are called defensins that we can put on topically to stimulate these LGR6 cells. So it's really what we refer to as a fourth generation. All of the products that we had prior to this, we were putting these products on our skin, stimulating our old cells to make new old cells. This is the first product of its kind. When you put it on, it stimulates your own skin stem cells to create new tissue. And we've really, over the past year and a half, we've been unable to keep it on the shelf. We see beautiful improvements in the texture, in the tone, in the general quality of skin. And so in showing patients the success of this product, it's really been a tremendous addition.
And so you obviously make sure to always have the product in the office so that if a patient right there and then wants to make sure to make that purchase, they're able to do so.
Definitely.
You never want to sell from an empty shelf.
No, and it's been a nice problem to have. We have a hard time keeping it on the shelf. It's become so successful.
It's a great opportunity. Absolutely, it's a great opportunity.
Now, what's very interesting about this, you've mentioned the efficacy of the product and actually what it does. And knowing that you treat all kinds of patients from the aesthetic, cosmetic, and as naturally as a surgeon, who are the patients that you would recommend this particular product of DefenAge to?
I think this is another tremendous benefit of DefenAge. Patients come to see me aging from 16 to 90. And when we started looking at DefenAge, we enlisted patients into an ongoing study looking at active acne, at acne scarring. We have a foundation for survivors of violence, so we have a large population of scar patients.
Right.
We started looking at scars, stretch marks as well. And so we've found in our early results of these studies really tremendous efficacy in the treatment of active acne. We've seen improvements in the quality of skin. We've seen softening of scars, softening of stretch marks. So again, we're seeing DefenAge being utilized by patients ages 16 to up to 90.
Wide variety of patient base.
I love that. So you're seeing amazing results with the line. You're seeing amazing results in your practice.
It truly, and again, another benefit of DefenAge is the results we see typically within 30, 60, up to 90 days. So patients have really appreciated, because at the end of the day, that's what patients want, expect, and deserve are the results that we tell them that the product can give them.
Absolutely. What sort of financial results have you seen? How has it helped you grow financially?
Sure. The price point of DefenAge is also very reasonable for patients, and the margins that we're able to achieve are really excellent with the product. The beauty of the product again is it comes as a 3-pack, but they can also be bought individually. There's also a travel pack, so it really comes in an assortment of sizes that a patient can customize their needs to.
I love that.
Many of us in this industry, we have our own variety of skincare products that we retail, we private label, we formulate. Can you give us any last minute tips on why this product has been successful in your practice, and actually give us some tips for all of our audience out there and other successful physicians and surgeons like yourself, that how it would incorporate it into a practice to really bring on us another successful skincare line?
And once again, we've achieved our success through educating our patients, and the education of the science behind DefenAge is really the key to its success. And that's really something that's why the product has been so successful nationwide, because the science behind DefenAge simply did not exist before.
This is Dr. Greg Chernoff, board certified facial reconstructive plastic surgeon, Indianapolis, Indiana, and Santa Rosa, California. Thank you, Dr. Chernoff. It's an absolute pleasure. Mine.
Thank you so much.